Hi students, welcome to the next video of oral pathology. In this video, we are going to discuss about oral submucous fibrosis. Okay, so oral submucous fibrosis, you may have heard about this oral submucous fibrosis and you may have read about it, but what they will ask you for your NEET INA-CT from your oral submucous fibrosis. Okay, so you may have learned many things about OSMF, but there are certain facts, there are certain things they focus for your competitive examination. So that's what we are going to discuss here. We are not going to discuss about the history, or we are not going to discuss about the pathology of this OSMF, how it forms and all. We'll have a just have a discussion about it, and we will see from which areas they pick up questions. Okay, so in oral submucous fibrosis, it is a oral potentially malignant disorder, and where, as the name indicates, you have so much of fibrosis of your oral cavity. Okay, the connective tissue of your oral epithelium, that below your oral epithelium, they will get hyalinized or collagenized, and patient will have difficulty in opening the mouth and all. Okay, so this is what usually happens here. Now there is one interesting thing that you should think here, that this is a potentially malignant disorder which can cause squamous cell carcinoma, right? But all the changes are occurring in the connective tissue. Okay, all the changes due to this oral submucous fibrosis is occurring in the connective tissue. But how then the cancer is developing in the epithelium? Okay, so actually the oral submucous fibrosis is occurring due to a habit. The habit of having tobacco with the arachinet. Okay, arachinet. So this oral submucous fibrosis is seen in chewers, okay, tobacco chewers who take arachinet along with this tobacco, this pan masala chewers. Okay, so this what type of habit can cause this condition called oral submucous fibrosis? Now, what this happens here, what is happening here is that when they chew this tobacco, it's not about smoking. When they chew this pan, when they take this pan masalas, when they take this pan or chewing tobacco in their mouth, these carcinogens, this harmful chemical agents, what they will do that the tobacco will attack the epithelium, causing atrophy of the epithelium. So the tobacco here, that is causing the epithelial dysplasias, epithelial atrophy. It can cause epithelial atrophy, and it can cause dysplasia. Okay, it can cause dysplasias. The arachinet here, the components of the arachinet, that is actually causing the fibrosis. Okay, that is causing the fibrosis in the connective tissue. Okay, so the cancer, the squamous cell carcinoma is still coming from the tobacco, and this is tending to squamous cell carcinoma, while the arachinet is the real causative for this, what your fibrosis. Okay, so what is happening here is that there is epithelial atrophy. So in oral submucous fibrosis, what we see is there is epithelial atrophy. Epithelial atrophy. Along with this epithelial atrophy, we have juxtaepithelial hyalinization. Juxtaepithelial means just below your epithelium in the connective tissue, there is abundance of collagen formation and there is hyalinization. So juxtaepithelial hyalinization. So this is what the Pinborg has told. Pinborg is the one who defined this oral submucous fibrosis, and he told that two things happen here. One is epithelial atrophy, and second one is a juxtaepithelial hyalinization. So why this hyalinization occurs when you are taking this arachinet? Okay, arachinet contains two things. Okay, they contains alkaloids. Alkaloids. There are two alkaloids present in this arachinet, that is called aracholine and arachidine. Okay, aracholine and arachidine are the two types of alkaloids present in this arachinet, and aracholine is the abundant one. This is present in large quantity. Abundance, it is present in the large quantity, while arachidine is the most potent one. The most potent alkaloid means even it is present in a small quantity, it is causing maximum damage. Okay, arachidine is very potent, while aracholine is the which is present in the abundance. Okay, and what they do, what is the function? What they do is that they will stimulate the fibroblast. Stimulate your fibroblast. They can go to stimulate your fibroblast. Now, what is the function of fibroblast? Fibroblast is going to produce collagen. Okay, so much of collagen, the fibroblast will secrete, or fibroblast will make so much of collagen. So there is so much of collagen in your connective tissue. Now there is one another component in this arachinet that is called flavonoids. Okay, flavonoids. What these flavonoids do is that our body has an enzyme to digest collagen. So whenever there is an increase in collagen, our body will make this enzyme. That enzyme is called collagenase. Okay, collagenase. So this collagenase is an enzyme which will digest this collagen or remove this collagen, but these flavonoids will inhibit. They will inhibit this collagenase. So what happens? It will stop collagen degradation. It will prevent collagen degradation. Collagen degradation. So what happens actually here? More of collagen is produced, and this collagen cannot be removed also. Okay, so that is why there is increased fibrosis. That all result in fibrosis. This is what resulting in fibrosis. So this is what happened here in a normal condition, in a normal condition. And there was a question. There was one MCQ question regarding this OSMF. Can you name an ion, a metal ion which is causative, or which is having relation in this oral submucous fibrosis? Metal ion resulting, or we can see related to your oral submucous fibrosis. Okay, this metal ion, that is copper. Now why copper? Copper is a coenzyme which will help lysyl oxidase. Lysyl oxidase is a enzyme which will help in collagen cross linking. That's make the collagen fibers more stronger. Okay, the initially formed procollagen, that is converted into stable collagen. They stabilizes the collagen. Okay, lysyl oxidase is an enzyme which will stabilize the collagen. They will help in cross-linking, and copper is required for this lysyl oxidase. Copper is a cofactor for this lysyl oxidase. So that's why we say copper is related to the metal ion, related to this oral submucous fibrosis. Okay, now most of the questions, they come from the clinical aspect. Okay, in the clinical features, you should be knowing about the clinical features of this oral submucous fibrosis. Now they may ask you, what are the signs and symptoms of oral submucous fibrosis? Okay, don't confuse sign with a symptom. Symptom is what a patient is telling. Sign is the clinical finding that the doctor can appreciate in the patient, right? So what is the first sign? So there was a question, that is the earliest sign. What is the earliest sign of oral submucous fibrosis? What is the earliest sign? Sign means what you can appreciate. Okay, what a doctor can appreciate, that is blanching of the oral mucosa. Okay, blanching of oral mucosa. The oral mucosa will appear blanched. Okay, because of this extreme fibrosis in the connective tissue, the blood supply will be reduced. Okay, when there is excessive collagen deposition, excessive hyalinization in the connective tissue, what happens is that it will get blanched because blood supply reduces. Now what is the earliest symptom that the patient will tell? Patient will not come to you and tell that I have blanching in the oral cavity, right? Patient don't know about blanching and all. Patient will tell what difficulty he has. Okay, so many of the students has what Gus did wrong, and many of the students have made mistake that this is difficulty in opening the mouth is what patient first feel. No, patient first feel, that is the earliest symptom. Earliest symptom is burning sensation in the oral cavity. They will get burning sensation, that is stomatopirosis. Stomatopirosis is called burning sensation. Okay, burning sensation is the first symptom that the patient is feeling. Okay, so don't miss this. They may ask you the first sign and first symptom. Okay, and what other things you can see in the patient with oral submucous fibrosis? You can see that there is fibrous bands in the oral cavity. There is fibrous bands in the oral cavity, in oral mucosa. Okay, both vertical and circumferential bands can be seen. Uvula will be shrunken uvula, or we say hockey stick uvula. Okay, that is one another thing. And then comes the difficulty in opening the mouth. That comes in the later stages. Okay, that is what you see. Now Pinborg has graded this into four stages. Okay, Pinborg is the one who has graded into Pinborg grading. There is a question in Pinborg grading. Pinborg grading of oral submucous fibrosis, he has graded. He said that there is four stages, that is very early, early, moderately advanced, and advanced. Moderately advanced and advanced, or advanced. Okay, and what you can see is that in very early stages you cannot see that much about the collagen bundles, and moderately advanced you can see collagen bundles. Okay, in moderately advanced you can see separate collagen bundles. Collagen bundles can be seen, and in advanced stage even the separated collagen bundles, they will fuse together and complete hyalinization occurs. Okay, so very early stage you will not see much of the collagen. In moderately advanced you can see the collagen bundles, and in advanced stage you cannot even see the separate bundles, you can only see hyalinization. Hyalinization means all the collagen bundles has joined together and it is now completely fused together. Okay, you cannot see any separation between these collagen bundles. Okay, hyalinization seen, and there is no separate collagen bundles. Okay, so this was one question in your INI-CT. Separate collagen bundles can be seen. A collagen discrimination can be seen in moderately advanced stage. Okay, oh, this is about your oral submucous fibrosis. And last one, there is a clinical staging. Okay, clinical staging. What is about the clinical stages of your oral submucous fibrosis? Okay, so clinically we are grading it into 6 grades. Grade 1 to 6, right? So we are going to grade it in 4, 5 and 6. I'm going to grade it. Now in the first stage, what you see? Only blanching. Okay, here if you are seeing only blanching and there is no symptoms, patient has no symptoms, symptom has not started, only the blanching has started, so we call it as grade 1. Okay, only blanching is there. Now in the grade 2 we have blanching is there, with along with it symptom has started. So what is the first symptoms to start? Stomatopirosis. Okay, stomatopirosis has started, ulcers has started. Okay, ulcers started forming, stomatopirosis. Slowly symptoms started. In grade 3, what happens is that it is grade 2 along with the patient will now start difficulty in opening the mouth. Okay, restricted mouth opening. Restricted mouth opening. So when you examine OSM of patients in your clinic or in your OPD, you can use this grade. Okay, so which grade of this OSM of it is? So patient has blanching is there, stomatopirosis is there, and restricted mouth opening is there. So you can say that it is grade 3. And grade 4 is grade 3 along with the what? Palpable bands. Okay, palpable bands in the buccal mucosa. In the buccal, if you palpate the buccal mucosa, you can feel the thick collagen bands being running, vertical and horizontal bands you can see. Now in type 5, what it is type 4 with tongue also being involved. Tongue is involved. Means even this fibrosis has started occurring in the tongue. Okay, fibrosis started occurring even in the tongue also. So that is type 5. And the type 6 is now nothing. It has already become a squamous cell carcinoma. Okay, it's already transformed to a carcinoma. So this is about your oral submucous fibrosis. I hope you understood what is the mechanism behind, what are the causatives behind it, and what are the signs and symptoms in oral submucous fibrosis, and how can you clinically stage it. Okay, see you in the next video with the new topic.